Welcome back to the Deep Dive. Today, we're shortcutting you straight to the heart of vitamin D testing.
And we're using some really focused guides from Blood Test UK to do it.
Exactly. We're looking at the crucial stuff you need to know, with a special eye on places like Ayr and South Ayrshire. Our mission is, well, pretty simple. We want to find out what vitamin D actually does.
The really vital jobs.
Yes. And why testing is so key, and of course, the great benefits you get when your levels are where they should be. This is all for you, the learner.
Okay, so to start, when we say a vitamin D test, what are we actually talking about?
Good question.
It's a check for the concentration of something called 25-hydroxyvitamin D, or 25-OHD in your blood.
And why that specific one?
Because it's the main storage form. It gives us the clearest sort of long-term picture of your real vitamin D status, not just what you had for breakfast.
That makes sense. And it's helpful that companies like Blood Test UK, they explicitly offer home visits right across the UK, including areas like Ayr.
Accessibility really matters. It has to be easy for people.
It does. Okay, let's unpack this. We hear about vitamin D all the time. But according to these sources, what are the two absolute foundational jobs it does for our health?
It really boils down to two things: structure and defense.
Structure and defense. I like that.
So maintaining strong bone health and supporting a robust immune function.
And the guides really emphasize this for people in the UK, don't they?
They do, and it's because of our geography. I mean, especially in winter, we just don't get enough sun. The sources stress that people in regions with limited sunlight really should think about regular testing.
So local experts are seeing this on the ground.
Yes, they often see residence levels dip, sometimes quite significantly during the darker months.
So this is essential stuff, not just nice to know. The general advice seems to be maybe get checked annually.
For most adults in the UK, an annual check is a really proactive step, yes.
Okay, so if we do that, what's the goal? What's the magic number?
The target you're aiming for is to be above 50 nanomoles per liter. That's 50 nanomoles. And hitting that unlocks some serious benefits.
All right, let's hear them.
First up, stronger bones. This is the big one. Vitamin D is like the essential partner for calcium.
It helps your body actually use the calcium you eat.
Exactly. It helps you absorb it, which helps prevent things like rickets or osteoporosis later in life.
Makes perfect sense. But I think the defense part, the immune function, is what really gets people's attention these days.
Absolutely. The second major benefit is fighting sickness. We're talking about critical support for your immune system. It helps your white blood cells, do their job and fight off germs.
And the sources mention respiratory health specifically.
They do. There's good data linking optimal levels to better respiratory health.
And it goes beyond the physical, too. There's a link to mood.
A very strong one. That's a third benefit, a better mood. Vitamin D is involved in making serotonin.
The happy chemical.
That's the one. It regulates mood. So this is vital for tackling things like seasonal affective disorder or SAD, that low mood that can hit when the days get short.
And what about the long game, the fourth benefit?
That would be long-term health. The sources mention that emerging research suggests having good levels might help lower the risk of certain cancers, like breast, colon, and prostate.
And just to remind everyone, this is all laid out in the guides from Blood Test UK.
It's all there.
So, back to accessibility. If you do live in or near Ayr, the sources point out some easy options, right?
They do. You've got larger places like Ayrshire Central Hospital, or you could go to your GP surgery like Ayr Medical Group, or even a high street pharmacy like Boots.
And what about preparation? Anything you need to do before the test?
Just the usual for a blood test, really. You generally need to fast for about 8 to 12 hours.
So no food or coffee?
No food, no calorie-containing drinks. And this is important. Always tell your doctor about any supplements you're taking. They can definitely affect the result.
Right. Good advice. So let's sum this all up for you. What are the key takeaways?
It's simple, really. Check your levels probably once a year.
Aim for that 50 centijoule mark.
And be extra mindful during the low sun winter months here in the UK. And here's a final thought, something the sources really make you think about. If you're dealing with fatigue that you can't explain, or maybe muscle weakness, or just a lingering low mood, just remember that strong connection the sources draw between those exact symptoms and a potential vitamin D shortfall. It's a really compelling reason to ask your doctor about this sunshine vitamin.
That's a powerful point to end on. A great reason to get it checked out. Thank you for joining us on this deep dive. You can find more details in those resources on the Blood Test UK website. We'll see you next time.